a world held hostage, the eerie silence of lockdown. The world changed overnight. Streets once bustling with life fell silent. Squares, usually vibrant with gatherings and laughter, stood empty. Cities, once the beating heart of human activity, transformed into ghost towns. An eerie silence descended, a stark contrast to the usual symphony of urban life. The invisible enemy, COVID-19, had arrived. Its presence, though unseen, was felt in every corner of the globe. Fear, uncertainty, and a sense of unreality gripped the world as we knew it. From whisper to scream, the unstoppable march of the virus. At first, it was a whisper, a distant news story from a far-off land. A few headlines here and there, a brief mention on the evening news. Most people paid little attention, thinking it was just another fleeting crisis that would soon pass. Then the whispers grew louder, spreading like wildfire across continents. The virus was no longer a distant concern, it was at our doorstep. Airports became hubs of anxiety, with travelers donning masks and gloves, hoping to shield themselves from the invisible threat. The virus, a silent and invisible enemy, moved with terrifying speed. It infiltrated communities, leaving empty streets and bustling hospitals in its wake. Medical staff, our frontline warriors, suited up in protective gear, bracing for the onslaught. It crossed borders effortlessly, ignoring the artificial lines drawn on maps. Nations that once felt secure behind their borders found themselves vulnerable. The virus respected no boundaries, no passports, no visas. No country was immune to its reach. From the bustling streets of New York to the serene landscapes of New Zealand, the virus made its presence felt. Famous landmarks stood deserted, a stark reminder of the global pause. The world watched in disbelief as the number of cases climbed, a grim tally of the virus's relentless advance. News channels broadcasted the rising numbers, while hospitals struggled to keep up with the influx of patients. From a murmur to a roar, the world was now facing a full-blown pandemic. Testing centers and vaccination sites became the new normal as humanity rallied together to combat the unseen foe. The unstoppable march of the virus had changed our world forever. Invisible walls, closed borders, and the yearning for connection. Borders slammed shut. Countries once easily accessible became distant islands. The free flow of people, goods, and ideas ground to a halt. The world, so interconnected just weeks before, was now fragmented. Families were separated, loved ones kept apart by invisible walls. The yearning for connection, for the comfort of human touch, became palpable. The pandemic highlighted the fragility of our interconnectedness, a stark reminder of how easily global ties could be severed. The human cost, isolation, fear, and the loss of touch. The pandemic has reshaped our world in ways we never imagined. Streets, once bustling with life, now stand eerily silent. Homes, once filled with laughter and gatherings, have become places of solitude. The absence of human connection has left an indelible mark on our hearts and minds. The pandemic exacted a heavy toll on our collective psyche. The once vibrant playgrounds now echo with silence, and office spaces that buzzed with activity are now deserted. The weight of uncertainty and fear has been a constant companion, affecting our mental well-being in profound ways. Social distancing, a necessary measure to curb the spread, brought with it a wave of isolation. Standing apart in lines, wearing masks and avoiding public spaces became the new norm. The physical distance, though essential, created an emotional chasm that many found hard to bridge. The simple joys of human interaction, a hug, a handshake, a pat on the back, became rare and precious. These gestures, once taken for granted, were now seen as potential threats. The warmth of a hug, the comfort of a handshake, and the joy of gathering with loved ones were sorely missed. A shared meal, a universal symbol of togetherness, became a potential risk. Dining tables that once brought families and friends together now stood empty. The act of sharing food, a fundamental human experience, was overshadowed by the fear of contagion. Fear and anxiety cast a long shadow over our lives. The constant barrage of news, the sight of empty store shelves, and the uncertainty of what lay ahead fueled a pervasive sense of dread. The psychological impact of the pandemic was as significant as the physical one. The loss of loved ones to the virus left a void in countless hearts. Funerals, once a time for communal grieving, were now solitary affairs. The inability to say goodbye, to hold a hand, or to share a tear added to the pain of loss. The pandemic underscored the fundamental human need for connection, for touch. The sight of loved ones separated by glass, reaching out but unable to touch, was a poignant reminder of our innate need for physical closeness. The barriers, both physical and emotional, highlighted the importance of human contact, for the shared experience of life's joys and sorrows. Despite the challenges, moments of connection, whether virtual or from a distance, brought solace. The smiles, the conversations, and the shared celebrations, though different, reminded us of our resilience and the enduring power of human connection. Section 5, Frontline Heroes, the relentless battle in hospitals worldwide.
Hospitals became war zones, the front lines in the battle against an invisible enemy.
Doctors, nurses, and healthcare workers clad in protective gear worked tirelessly, risking their own lives to save others.
They faced exhaustion, shortages of supplies, and the heartbreaking reality of losing patients despite their best efforts.
Yet they persevered, driven by a sense of duty, compassion, and unwavering hope.
They became symbols of courage and resilience, a testament to the indomitable human spirit.
Section 6, Economic Ruins, the crushing weight of a global recession.
The pandemic's impact extended far beyond the realm of health. The global economy, already fragile in many parts of the world, went into freefall. Businesses shuttered, unable to withstand the sudden halt in activity. Unemployment soared, leaving millions struggling to make ends meet. The pandemic exposed the deep inequalities that existed within and between nations. It highlighted the precariousness of many livelihoods, particularly those in the informal sector and those already living in poverty.
Section 7, Science to the Rescue. Vaccines, treatments, and a glimmer of hope. Amidst the despair, a glimmer of hope emerged from the world of science. Researchers worked tirelessly, racing against time to understand the virus and develop effective treatments and vaccines. Their dedication bore fruit. Vaccines, developed and tested at an unprecedented pace, offered a path out of the pandemic. Treatments, though not a cure, provided much-needed relief and reduced the severity of the illness. Science, often taken for granted, became our lifeline, a beacon of hope in a world shrouded in uncertainty. Section 8. The long road back, rebuilding lives, communities, and economies. The road to recovery is long and arduous. The scars of the pandemic are deep, etched into the fabric of our societies. Rebuilding lives, communities, and economies will require a sustained and collective effort. It will demand compassion, cooperation, and a renewed commitment to social justice. We must address the inequalities that the pandemic exposed and build back better, creating a world that is more resilient, equitable, and sustainable. Section 9, a newfound appreciation, cherishing health, freedom, and each other. The COVID-19 pandemic was a stark reminder of the fragility of life and the interconnectedness of our world. It brought to light how quickly our daily routines and freedoms could be disrupted and how vulnerable we all are to global events. The virus did not discriminate. It affected people from all walks of life, across every continent, showing us that in many ways we are all the same. It forced us to confront our mortality, to re-evaluate our priorities, and to cherish the simple joys we often take for granted. Suddenly, the things we overlooked became the most important: spending time with loved ones, enjoying a walk in the park, or simply having the freedom to move about without fear. These moments of reflection and connection became our lifelines, grounding us in a time of uncertainty. We emerged from the pandemic with a newfound appreciation for health, for freedom, and for the irreplaceable value of human connection. Health, which we often take for granted, became a central focus. We learned to value our physical and mental well-being, understanding that without health, nothing else matters. Freedom, which we never imagined could be restricted, became a precious commodity. And for the irreplaceable value of human connection, the joy of a hug, the warmth of a smile, the comfort of being in the presence of others, these became treasures we longed for. Reuniting with friends and family, participating in community events, and simply being together became moments of profound joy and gratitude. Let us carry these lessons forward, building a future where we prioritize the well-being of all, where we support our healthcare workers, and where we come together as communities to help those in need. The pandemic showed us the power of collective action and the importance of looking out for one another, where we safeguard our planet, recognizing that the health of our environment is intrinsically linked to our own well-being. Sustainable practices, conservation efforts, and a commitment to protecting our natural resources are essential for a thriving future. And where we celebrate the precious gift of life itself, let us embrace each day with gratitude, cherish our relationships, and strive to create a world where everyone can live with dignity, health, and happiness.